Sorry.
Benefits.
Yeah.
You know, I was like,
Oh, yeah, that's fine.
I know, I was thinking it was a resolution doesn't vibrate on the table, right? No, it doesn't. Okay.
Okay, it's too much in my head.
Christian
All lowercase.
and our family.
Alright, so share it with.
Yeah, take it, but they say a really good one. If you have germs that get into your nostrils.
Right, are the flags in the right position?
They are correct today, yes.
Thank you.
Yours were not wrapped on.
I don't remember what they were, how they were situated, that's why I need to remember this section.
The US flag is always to the left. Exactly.
Are we ready, Edward?
We are ready.
Okay. Ready for it? We're gonna go ahead and welcome everyone to the Livingston Health District Board meeting of February 24th. Can we go ahead and have a roll call, please?
Director Smith.
Here.
Director Rogers.
Here.
Director Foresthill.
Here.
Director Longstaff. Secretary Delara.
Here.
Vice President Rodriguez.
Here.
President Peraza.
Here. Thank you. And if you can please join me for the pledge of allegiance. Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Next item of the agenda. I'm looking for what. I would like to make change on the agenda. There is an item that's listed as an action item, just that does not need a vote from the board. So not sure if, I guess, we could modify it to within the motion, or if the board decides to continue in keeping it as an action item, but maybe it's it should be informational, and that's item H3. H3?
Each.
Interest
cat.
So there it's, doesn't have to take action? No, for legal counsel, there's no action required by the board. This would be.
Yeah, I mean, either way, you can do it either way, whether it can be an informational item or it can be an action. And I think Kimberly expressed that she felt more comfortable having the informational.
I want to go by legal counsel, so legal counsel tells us that it's informational.
It can be, it's certainly permissible, but it's up to the board. You wanna make it an action item or if you wanna make it informational, either way.
I'm okay with informational, does that need to vote?
And so we have a motion in a second, so we would have to either modify that or then vote on the motion in a second. But I'll share the reasoning why, if it's something that's still discretion of our CEO, I wouldn't want to set a precedent that we would expect them to bring salary arrangements, adjustments for the future boards if not needed.
So my reasoning for thinking that it was a policy was because it was an increase from the budget that we approved back at the beginning of the fiscal year. I totally agree that it is the CEO's discretion for merit increases. But that was the only reason why I put it.
So, you moved on this, there was a second, we can go ahead and have a roll call vote.
So what is the action that we're voting on, to approve it as is or to make the change?
Just to put it as an informational item.
Okay,
And who moved it?
I move the original motion, I will.
To accept the
second
agenda.
it, that with, to make it an informational item.
And I'll maintain the second.
Okay. Roll call, please.
Director Smith.
Yes.
Director Rogers.
Yeah.
Director Correzio.
Yes.
Secretary Delara.
Yes,
Vice President Rodriguez.
Yes,
President Barraza.
Yes, thank you. Agenda approved. Next item is public comment. At this time, comments from the audience may be made on items not listed on the agenda that are part of public interest and within the subject matter jurisdiction of the district. The board has a policy of limiting speakers to no more than 3 minutes. The board cannot take action on items not listed in the agenda. Public input may be offered on agenda items when they come up for discussion and for action. Are there any public comments?
There are no public comments online. There are none in the audience.
Thank you. Next item, consent agenda. Any questions, any items that need to be pulled? I will entertain a
I
motion.
would like to just make a correction on item E, the minutes of the January 27th. Just to make the correction that on the, on item E, that on that action item, it was stated that Director Perez Gill was abstaining, but she actually wasn't present, so just to make that correction. With, other than that, I move approval of the consent.
second,
Roll call please.
Director Smith.
Yes.
Director Rogers.
Yes.
Director Corezio.
Yes.
Secretary Delara.
Yes,
Vice President Rodriguez.
yes,
President Barraza.
Yes. Thank you. Next item, resolution, Jeff.
Yeah, thank you. Madam President, I just wanted to read into the record resolution 2602, marking the passing of our colleague Arthur Shore. So this is a resolution of the Board of Directors of the Desert Healthcare District, commending and honoring the services of Arthur Shore. Whereas Arthur Shore was appointed to the Desert Healthcare District Board of Directors in April 2019 and was elected for 2 consecutive terms and retired on November 30th, 2025. And whereas Arthur Shore passed away on February 8th, 2026, and he spent his entire career in healthcare leadership, serving as a hospital administrator and executive in Detroit and Milwaukee, and most notably as the Chief Operating Officer of Cedars-Sinai Medical Center in Los Angeles, California. And whereas Arthur Shore was deeply committed to teaching and mentorship, he was a lifetime fellow in the American College of Healthcare Executives, and he served as an adjunct professor at the George Washington University Graduate School of Public Health. And whereas Arthur Shore provided strong and insightful leadership for his fellow district board members throughout his board service, and most significantly during the COVID pandemic and the extensive negotiation process of the 30-year lease and purchase agreement with Tenet Healthcare. And whereas Arthur Shore was deeply respected by his fellow board members, staff, and the community served for his wisdom, personality, and dedicated service to the district. And whereas the services of Arthur Shore have materially contributed to growth and finance, I'm sure Arthur would find it amusing or it was
Or he's present.
you know, he probably did that himself.
Okay. All right.
Okay. I'll open up for any board member comments and then public comment, and then we'll go ahead and vote on the resolution.
So I would also like to discuss an associate memorial for Art. Since in the past, we installed a park bench at our memorial park. I was thinking along the lines, I was told by staff that he the water fountain is being repaired. And a plaque on the water fountain would certainly be a more permanent marker to place his name as a memorial for his service to the district.
One's already been named, one has already been named.
Okay.
The opportunity, but they're both permitted planters because they turned off the water. Working with the Parks and Rec. Continue making, that's functioning fountains. There should be another fountain around.
One of those fountains that we could name. We want to do that.
Any comments on that from or
I think there was a recognition to the community to be able to do that, and at the same time, even that, a board member that made some significant contribution at a very difficult time in our district. I also would, if you don't mind, I would just want to add that, well, I will always remember Arthur as a board member that had extensive experience. His qualifications were definitely the reason why he was selected above everybody else when he applied. But what I will always remember is the fact that he was always willing to listen to me, even by not having the experience that he had, but willing to listen and learn from others. So I appreciate that. And I told him that when he decided to retire from the district. And I also will remember that he would always come up with a quote that would definitely be very colorful and restated in our newspaper and our media. So he definitely could make something very boring, very delightful, very amusing sometimes. So just want to mention that he was a very special person, and I appreciate everything that he did contribute to the board, and I appreciated working with him during that time.
thank you. Any other comment? Any comments from the public?
And no public comment.
So is there a consensus from the board that we'll have staff take a look at what are the options for this memorial?
Yeah.
Yes. Thank you, then we'll go ahead and do a roll call now. Was there? Did you have a question, or was there?
With what was the motion?
Oh, it's roll call vote to approve the resolution.
Okay.
And who moved it?
It wasn't,
You can make a motion.
do we need a motion?
I will just leave out the resolution.
I'll second.
Thank you.
Director Edward Smith,
Yes.
Director Rogers,
Yes.
Director Carrasco,
Yes.
Secretary Delara,
Yes.
Vice President Rodriguez.
Yes.
President Velasquez.
Yes, thank you. Our next item, presentation, Sunline Transit Agency, Rights Reimagined, presented by Mona Babalta. Thank you, thank you.
You can put your.
Yeah, I can go up to the front? Yes. Okay.
Let me pull it up.
Thank you, President Barraza, Vice President Rodriguez, directors, and thank you, Chris, for agendizing my presentation today. I'm Mona Babalta, I'm the General Manager for Sunline Transit Agency. I've been there about 2.5 years, so I'm still relatively new. But I'm excited to be here to share a little bit about an initiative that is currently moving forward. It's called Sunline Rides Reimagined, and really it's a process that involves reimagining how our system is designed with help from the public. And so
Let me share your presentation.
Yeah, thank you.
With the public.
Thank you so much. And so basically, I have been going around the valley. Just so you know, I'm presenting to all the city councils, all of the councils of the unincorporated areas of Riverside County and the Valley. And I'm towards the end of my long list of presentations. The only one who is left behind you is the city of Desert Hot Springs. So again, thank you for having me. And I'm gonna start by talking a little bit about the Sunline Transit System, in case there's anyone here who could benefit from that. But Sunline Transit is your local public transit provider for the Coachella Valley. We've been doing that. We've been your provider for over 49 years. Next year, we celebrate our 50th anniversary. So this is sort of setting us up for the next 50 years of our existence. But Sunline is a joint powers authority. It's made up of the 9 cities of the Coachella Valley, as well as the unincorporated areas. And those areas are represented by Supervisor Perez. Our service area is over 1,100 square miles. It spans all the way from the Salton Sea in the east, so North Shore, Mecca Thermal, all the way to San Bernardino County, actually. So we provide local routes, local service within the valley, but we also provide a commuter route that goes all the way to Cal State San Bernardino, where we carry a lot of kids who go to college out there. We also serve downtown San Bernardino, where we connect with Metrolink and our other transit providers like Omnitrans and Riverside Transit. So we ensure that there's a connection between our residents here as well as other regional providers within the Southern California area. Not only do we provide the service on what we call our fixed route system, which is the big buses. So the big buses that say Sunbus, we run those, but we also provide other services like Sundial, which is complimentary paratransit. So complimentary paratransit is meant to complement the fixed route system so that those who don't have the physical or cognitive abilities to take the big bus, they could be eligible to take paratransit. They need to get a medical provider to certify their disability and become eligible for that service. What's tough is that because our service area is so vast and because we don't have, in fact, it's so vast when you look at the total land area of the Coachella Valley, it is basically the same as the total land area of the state of Rhode Island. So it's a very big service area that we have to serve. And we do it with an annual operating budget of a little over $50 million. Our capital budget is over $100 million. We're a very capital intensive operation. But in addition to those services that I talked about, we provide other services because unfortunately we can't provide service throughout the whole area. So in order to fill in the gaps, we provide our version of on-demand transit similar to Uber and Lyft, and it's called Sunride. So if you call a phone number or you pull up the Sunride app, you can book a ride for about $7. We have 8 geofences within our service area. And so if you're within a service area, you could book a ride to travel anywhere within that service area. We are also the taxi regulator for the Coachella Valley. And through our relationship with the local taxi providers, we provide a discounted taxi program. So everyone who is over the age of 60 who has a qualifying disability qualifies for this taxi voucher program. And you can go online to www.sunline.org to get more information on how you could qualify for the taxi voucher program. But basically for every dollar a person puts in to a ride, we will match it with another dollar, up to $75. So every month, $150 worth of taxi rides could be subsidized for those who are eligible. That is a very nice benefit that not a lot of transit agencies provide, but we provide that knowing that our buses can't go everywhere. So we really do our best to provide a menu of options that will try and meet all of the mobility needs of our citizens of the Coachella Valley. We carry about 3 million people every year, just so you know. And about 15% of that is made up of children. And the majority of our ridership happens here in Palm Springs, actually. The second highest ridership is in Cathedral City. Our third is Palm Desert. So just within this sort of western area of the valley, the majority of our rides, probably close to 60% of our rides are taken in this area. So I'm going to talk a little bit about Sunline Rides Reimagined. So again, it's our way of reaching out to the public to help us redesign our system. It's an 18-month process. We started out by looking at ridership data and other data points, like when most people travel, what time of day. You know, what are the key collection points where people travel to and from within the valley? We want to really understand travel behaviors among all of our riders and here in the community. What we also want to understand better is why people don't take the bus. What are those factors that make it difficult for them to utilize public transit or any of our other alternatives? Is it because they don't feel safe at bus stops? Is it because the bus doesn't come as often as they like? Is it because they're afraid to get lost? We want to understand those community sentiments to better help us design a system that works best for all of our community members. So yeah, we are going through a survey process. And the online survey is actually still open. And at the end of the presentation, you're going to see a QR code that will take you to the online survey. That is in English and in Spanish. And outside, and actually, I also left some flyers out on the front table that says a little bit about what we're doing. It's done in English and in Spanish, and the QR code is here. So if you scan it with your phone, you can go to the online survey. Up front, I also left paper copies of the survey with instructions on what to do with it. And it is in English and in Spanish. Through the survey process, we're asking demographic questions. We're asking questions about how often you ride, and what those questions will lead us to is basically, how do people want the service to be designed? Do they want it more focused on high density areas, or do we want service throughout the valley? Essentially, us designing a system that provides lifeline service, so everyone will have access to the bus to some extent. It won't come as often as possible or as we would like, but at least it'll reach all areas of the valley. But those are some of the things that we want to gather through the survey process. And here is a real quick diagram of that talks about the process. We're sort of in the beginning. So it says February 26th, but again, the survey is still open until for another week and a half. So after we close the survey process in about a week or a week and a half, we're then going to start looking at the feedback that we got. We're going to start looking at our data and gleaning things out of that. We're trying to, figure out what are the right service alternatives for our community. So, how often the bus goes and where it should make a left or right turn, where it should stop, things like that. So it's all for service alternatives that we'll consider. And then we eventually will take those alternatives and put them into scenarios. We're going to produce 2 scenarios that will reflect a coverage base, meaning the buses will go throughout the valley, or a ridership base, which will be more focused on high density areas that will help us build greater ridership a lot faster. And those 2 scenarios will be taken to the board for action in the May to June timeframe. Before we do that though, we're going to do another phase of community engagement. We want folks to look at those maps that we plan to have the board take action on, give us feedback. Tell us if we got things right, if we heard them correctly and accurately through the community engagement, the first phase of community engagement. When the board takes action or gives us feedback on a scenario, we will then start working on a draft plan. Once we develop that draft plan that will include the preferred scenario, we will then do phase 3 of community engagement. So we're going to ask the board or the community to give us more feedback before the board takes final action on a final report. So there's going to be 3 opportunities for the community to engage with my Sunline staff and with me to make sure that we are getting things as right as possible. We acknowledge we're not going to make everyone happy, but we are going to try really hard to do that though. And then at the end of the year, towards the start of next calendar year, the board will take action on a final plan. And that final plan will reflect the final service scenario on which my staff will make service changes for the next 5 to 6 years. We only do this extensive process about 5 to 6 years, just because it takes a lot of time, it takes a lot of effort. And And we make service changes about we make 3 times a year, actually. It's dictated by our contract with our bus operator. And then from there, we will also look at other things like infrastructure improvements and plan for that. Because through this process, not only will we be reimagining how our service is delivered, but we also want to take a closer look at where our bus stops are. Whether or not our infrastructure is right, whether or not we need to do things like provide better shade structure. So it's all of those things that we're taking into consideration as we go through this process. And before I end, I do want to just share just a few more things. So Sunlight provides the vast majority of our service using zero emission hydrogen fuel cell technology. And here on this slide reflects 2 different forms of fueling. And the one thing I do want to share is on the left is our hydrogen electrolyzer station. That actually we produce hydrogen on site. So through a chemical reaction, we take water, we take electricity, we merge them together, we create a chemical reaction. We capture the hydrogen that we then compress into a gas that we can put into our buses. And we separate out the oxygen. And on the right is our liquid hydrogen station. So we have another form of fueling, and that involves getting hydrogen delivered to us in liquid form. It's actually -425 degrees when we store it on site. So they call it liquid, but what I heard was it actually is closer to Rice Krispies when it's in there. And through that technology, we actually heat it up. We vaporize it and we get it to -40. It has to be at -40 degrees in order for us to fuel our buses. So what we do there is actually pretty interesting. And my staff has been trained to do work on both of these stations, which is rare. You don't find a lot of transit agencies that actually do this kind of work in the hydrogen space. And in fact, we are the only transit agency in the entire nation that produces as much hydrogen as we do on site. And it's all zero emission. So if you get stuck behind a hydrogen bus, please know that you are not inhaling any harmful chemicals. The byproduct from a hydrogen bus is actually water. So you'll see water come out of the tailpipe every now and then. There is a
I just have a question.
So,
Go ahead.
excuse me, we will take questions after the presentation.
Okay.
Thank you. And then our fleet, again, we have 32 fuel cell buses. We have 4 electric buses. That is actually about 41% of our total fleet. We only need about 50 buses to make pull out. So it actually makes, we do our best to put out these buses. So it's actually closer to 70% of our active fleet that's zero emission. Good, move on. And I also want to share that even though we are known as the transit provider and our #1 priority is to provide public transit service to the community, we also do a lot of work around workforce development. So because of the work that we're doing in hydrogen and because there aren't a whole lot of folks who are involved in that space, we put a lot of emphasis into workforce development and hiring local people, local residents, and giving them that skill set to work for us and maintain this bleeding edge technology. So it is something we're very proud of. We work very closely with the union and we work very closely with the College of the Desert to establish and develop a curriculum to help build up the skill set of our employees. And I think that's it. So I want to thank you all for your time today. And here you'll see the QR code. Please take the time. I ask you to please take the time to give us some feedback on our transit system. Tell us what we're doing right. Tell us what we need to do better. And tell us what you would like to see out of a public transit system.
Awesome. Thank you, Mona. Thank you for adding us to your list of, public outreach. We ourselves are going through our developing our new strategic plan. So it was, in good timing that you came and presented. We are aware of who and what Sunlight does, but it's always good to get a little bit more information. Before I open it up for questions and comments from the rest of the board, I have a few questions. A couple of them. One, and if you are able to speak a little bit on the partnerships, I believe that there was a partnership with school districts where students would be able to ride the bus at like a
Yes.
discounted price, and then also your fuel cell pumps. Was there some efforts to have them be open to the public?
Yes, that is what I forgot to mention earlier on the slide when I was showing, that's why I wanted to show the infrastructure. So the liquid station actually provides a public fueling dispenser. We are still getting that certified by the state. We are really close to getting it certified though, or so that we can sell the product. We could actually fuel right now, but we actually need state certification to actually sell it. So we're very close. So give us another couple of months and we should be open for business.
That is great news because my daughter just got a car. Oh, that's fuel cell.
Yes.
And she's like, Mom, I have to go pump all the way to like
Yes.
Moreno Valley. And I'm like, oh, sunlight.
Yeah.
Yeah,
So-
so I'm like, that's not gonna work, but thank you for that. Then I also want to thank you because I believe that, if I'm not mistaken, last year you were one of our stops on for our tour with the healthy desert healthy youth. I really do appreciate that. And I'm looking forward to other opportunities for us to collaborate
Absolutely.
in the near future and, you know, within the lives of our organizations. So thank you for that. We'll go ahead and start with Dr. Luxon.
Oh, thank you so much for the talking, and it's great to have you here. I had a couple questions. I missed the general mission statement of what you guys, I just want to get a quick mission statement from you and then I have a couple
Yes.
questions. Sorry I was late.
So it is connecting people and improving life by taking you from where you are to where you want to be. So that is, I think my staff is there. Did I get it right? I got a thumbs up from my CFO. That is, that is our mission statement. And we really strive really hard to take folks from where they are to where they want to be. Not only literally, but also through our workforce development programs, figuratively speaking as well. Yes.
Another question, your hydrolyzer, your electrolysis machines.
Yes.
Where are you getting the electricity for that from?
We get it from the grid right now. We are in the process of, we did get an earmark from Congressman Ruiz to do A&E to build a microgrid. So we are actually gonna issue an RFP if we haven't already done it very soon to start A&E on a microgrid. And then we're actively looking for construction money to build it.
So would that be solar then, you say microgrid, or do you
Yes.
natural gas?
Yes, we will be capturing solar energy through the microgrid and then using that to power the electrolyzer to the extent that we can. Yeah, we probably won't,
So where's your energy currently coming?
it's coming from the grid, it's coming from IID. Yeah,
And what's your current funding source?
so operating funds, over 50% of my operating budget is funded with state Transportation Development Act funds. Yeah, the other 50% is basically a mix of federal funding, local funding, sales of CNG, and soon hydrogen. We also get credits for operating a zero emission fleet. So we do get a lot of other subsidies to fund our operation every year. And a large portion of our $100 million capital program is also funded with state and federal grants.
Yeah, go ahead, Director.
Thank you for your presentation. I wanted to say something about who your best ambassadors are, and those are your school bus or your bus drivers.
Yes.
A couple times I went on the bus from where I lived to Turtle Palm Springs because I was told parking was terrible. And on the way back, one of your bus drivers stopped your bus, got out and hugged a homeless person and said, I haven't seen you in a long time, how have you been, what's going on in your life? I mean, you're like, she was like a bus social worker, she was wonderful. And then the other time was where we were working with our mobile medical clinic in Desert Hot Springs. And a bus driver was part of the people there helping us set up. And he said, give me flyers, I'll give them to homeless people on my bus. So now that's a permanent source of information with online bus drivers.
They are, yep, they are ambassadors. My hats go off to all of them because they gotta show up on time. They pull out a bus that is several tons. And it's not only do they have to drive it, but yes, they are social workers, they are my customer service representatives. In some cases, they are medical providers. You know, if there's any medical emergencies on board, they try and help with things like CPR or anything else, you know, they work hard every day. So I am grateful to the work that they do and thank you for highlighting that.
Any other comments?
I have a question on, as you're going through the different alternatives, is this an either or situation?
It could, so basically, we are going to give it our best shot at either or. But they're probably gonna, my board's probably gonna say, hey, we want a mix of both.
Yeah.
So figure that out with the 4 different service options that we provide, the fixed route, paratransit, Sunride, which is our version of Uber and Lyft, as well as our taxi voucher program. So all of those 4 modes should help us try and cover the entire valley one way or another. Yeah.
Yeah, and just the last comment is that, but I have an autistic son who utilized Sundial to actually get from home to COD, and it's an amazing service, so I don't think it's tapped into as much, so. And the only reason I brought up the question before is just the transportation needs for the eastern part of the valley, especially out Mecca and North Shore in that area, I would hate to see that reduced in any way.
Yeah.
At the need of expanding service within high density areas. If you look at, and I know the ridership is high in Palm Springs, Cathedral City, Palm Desert. There's a higher level of income though in those communities as well, who have more access to transportation per se than those that are in the eastern part of it, and also Desert Hot Springs.
No, I'm very familiar, you know, what's tough is that there's not a lot of infrastructure out there too, so it's really hard to stop the bus everywhere we would like to.
Right.
Because of that, but we continue to collaborate with other partners to try and make improvements out there.
And you've done an amazing job over that. I used to work for Supervisor Perez, so sat with him on some transit board meetings, so.
He's a huge
Yeah,
advocate.
you guys have done an amazing job of that expansion of service.
Any other comments?
Okay, so my question is, well, for starting with, we're here addressing the healthcare district. So looking through the healthcare lens, how do we improve information with the healthcare lens? So you mentioned the community engagement meetings. But when we did ours, just learning about, you know, from how we've done ours, we've had in some cases very low turnout in some of them, not as good of a turnout as we would like. Thankfully, though, our team has done the extra work of having some stakeholder meetings and so forth. So if you have done that, I hope that you have included the healthcare professionals like the FQHCs, that thankfully we have them in, like Greg said, in some of the more remote communities. And hopefully you're getting input from those that are serving the residents and also residents that are using those services, so.
Yeah, thank you for that comment. You know, in addition to all the surveying, we're actually putting boots on the ground. So we had people stand at bus stops. We have folks out in Mecca, North Shore, Thermal at the different clinics, actually trying to gather feedback from the folks who utilize those clinics as well. So we're doing our best. We recognize that not everyone, you know, has access to an online, you know, portal. And sometimes it takes time to actually read through a survey. So to the extent that we can actually be there with someone and help them understand what we're doing and just have them respond to questions and we fill things out for them, we will do that.
Great. And also the other thing is, I'm with that also the healthcare lens, I think you're probably using other information, and the one that pops into my mind is later this week, Thursday, Park is releasing their community survey. So I'm sure that one of the things that always pops up is lack of transportation. So you could just kind of keep that as one of your indexes of the information to be able to access.
Okay, that's good information. Thank you.
Thank you.
And I did want to respond to the U-Haul program or the Hall Pass program, not U-Haul, Hall Pass program. That is actually our program for high school kids, so that they can get to and from school for free, actually. And we even go a step further and we'll design routes that will gather kids and take them to school. And when the bell rings, we will pick them up and take them back to where they came from. Yeah,
You guys,
yeah.
think about that and our family members are.
They just need to apply. So every year we try and get the information out and we tell all the kids and their parents to start, just applying for the Hall Pass program. And we also have a partnership with COD and Cal State San Bernardino so that kids can get to college at a subsidized rate. Or is it free?
It's free for the college and stuff like that.
Okay, the colleges pay for them.
Thank you. Are there any other comments or recent comments?
Go ahead, thanks.
So thank you for your presentation, and I was just looking through the slide here and it mentions as part of what you're working on, which we can appreciate because we're also in the middle of strategic planning, but improving access to jobs, schools and healthcare. And I think we would definitely be interested in kind of what ideas you come up with
Okay,
specifically, as it concerns healthcare, because in the midst of our planning as well, what you're doing, those are kind of the ideas that we'd like to hear and we want to hear.
okay.
And I do believe that do we have one more session, a Zoom session? Is that what it is?
The virtual session.
Virtual session, yeah, so, just so we know and that if there's space for hopefully collaboration there,
Okay.
we can get an idea of also what your thoughts are, so that can also inform our plan.
Absolutely. As we
Thank
go through
you.
this process, I'll keep Chris involved. Yeah.
Thank you.
Alrighty. Okay, thank you so much.
And thank you, I appreciate it. Kind of interesting because both Mona and I were running into each other. I knew she worked at the city council meeting, so she was designing right to I was doing our strategic planning. So, yeah, so it hurt my ears too, because as we're talking with our strategic planning. And we're talking social determinants of health and transportation is mixed in with that, so I think there's potential alignment here that. If we're working through ours.
There's definitely a nexus. I just, it's hard to go see the doctor if you don't have a ride.
Right.
So to the extent that we can help keep this community healthy by providing rides, that's what we're interested in. Okay, thank you so much. Thank you.
Thank you all. Thank you. Alrighty, so we're gonna go ahead and go on with reports. First, Destiny Regional Medical Center CEO, before.
It's online.
Online.
Here.
We had a little fire crossed with the wrap up the services here, so. I believe it's on. Let's go over there.
Can you all hear me?
Yes.
Yes.
All right, apologies, both Linda and I got a little confused with location and went to wrap, so apologies again. So my report is in your packet. We've had a busy month and still upcoming with a lot of different community events, education sessions, and we've completed a lot and have a lot in the upcoming months. I did want to highlight last week, we had a wonderful ribbon cutting event for our new outpatient cardiology clinic. This was on Wednesday. We combined this with a health screening called Affair of the Heart. We had really great attendance, over 100 people, I believe, and we were doing a lot of health assessments there. At the session, we were actually able to sign up 6 new patients for the new clinic who had shared they were having a difficulty getting access into cardiologists. It was really, really successful and well attended with elected officials, some of the folks from the district. We thank you for coming. So a nice event there. And we continue to make progress with our various projects that we've got going underway. A couple elevators are done. We keep moving through that. We're nearing our completion of the ORs. And we did meet, I think I shared last month, but I just wanted to reiterate the deadline for the submission of the architectural plans for seismic actually got pushed back to, I want to say the end of February, March this year, but we still met the original deadline and got it in early December. So the state is working through our submission. And we're eager to get going. That's what I have for you today.
Awesome, thank you. Are there any questions from board?
I do have a question. After you done,
Do we have a copy of the seismic plan that was submitted?
So it's a very complicated plan. I was describing it to Chris. There's hundreds of documents that were submitted. For context, Desert Regional is licensed as 22 separate buildings. So there was the initial building, and every time there's an addition that's been put on, that's essentially a separate licensed building. And every building has its own submittal package. And our architect has put all that in. It's not public yet in what's put online. So when it's public, you'll be able to see it. But at this point, they're still reviewing all of the submissions that we've put in. But once it's public, we can share how to get the access so you can look at that stuff.
Thank you, Director Villa.
Okay, so, Mike, during our community engagement sessions, there was some comments, that were shared by some of the residents in the Eastern Valley about JFK. And they're a little bit, similar to some of what we've heard in the past, just the disappointment, that there's just some performance issues there and the ability to actually, have the capacity to address the Eastern population. So I was just wondering, as I'm remembering these comments, how was your operation coming along, especially since we're coming out of this very busy season when you have not only the normal residents coming through the hospital, but you have the seasonal coming in. What can you tell us about what you're seeing at the hospital, the emergency room? I know it's flu season, and it seems like this year the flu season hits pretty hard. I don't know if that's just people that I know. So in the past, we've gotten that kind of information from Michelle when she used to report a little bit about what was the general, not like into too many specifics, but how you were managing the needs of patients coming through. So can you give us a little bit of, I know it's not typically in your report, but I always mention JFK because that is something that even though we're not responsible for JFK, it is something that people attribute healthcare, and because it is tenant that we, there's just some information that we could gain a little bit more than we could understand what you're facing in the East at JFK.
Sure, I can give you a few updates around that. Interestingly, the county-wide is kind of surging right now. We're seeing reports of EMS visits up, increased amount of ambulance offload delays throughout the county. We at Desert this week have had a really high census up in the 370s. And so we're working very closely with our community partners. We've had more of a spike on the western side of the valley than we have down at JFK. As it relates to flu and influenza-like illness, interestingly, last year in the 24-25 flu season, our peak month, I believe, was January, and we had 70 admissions at Desert. I don't have the JFK numbers, sorry. But our peak number of admissions with flu was, I think, January, and we had 70. This month seems to be the busiest month so far in the 25-26 flu season. And through the midpoint of February, we had 15 admissions. So I'm knocking heavily on wood right here. The flu admissions are not as remarkable as they were last year, but we are tracking, this being the busiest month and to see where that goes with our census right there. So we work closely with JFK and, making sure we can care for the patients at each location. With regards to the ER, I know you asked about this and I appreciate that. We are still in the feasibility study of the next round for the building of the new emergency department at JFK. We have gone through 2 previous versions, and for various reasons, we're not able to move forward, whether it's the fact that we didn't own certain land where we wanted to grow, but we're getting towards the end of a third round of feasibility, and I think we have a nice option where the new emergency department for JFK would actually be built on the west side of the campus and the central plant on the eastern side, but that process is still underway. And so once we ultimately determine that it will be feasible, that we can do it in that location and maintain adequate flow of traffic, what have you, then the next steps for that is to get the full architectural engineering study put together that would then go before the state. So that's kind of the high level of what I can share with you right now.
Okay, I'm just remembering that in the lease agreement that we approved, that is one of the things that we did include in there was the emergency room. So I do hope that that is something that is done at the front end, not too far into the future. So thank you, appreciate your comments.
Of course.
Any other board member comments, questions? All right, seeing none, thank you. We're gonna go ahead and move on to our next item. This is Regional Medical Center Governing Board. Dirk, I believe that you
So
have
the report is in the packet, happy to answer any questions.
any questions? No. All righty, we're gonna go ahead and move on to Desert Health District CEO report. Chris?
Thank you, President Barraza. The first item on the agenda is the strategic planning, community listening forums. And this is just a verbal update and acknowledging the hard work of everybody, including the board, in conducting these community listening sessions. We did 7 sessions across the valley in each of the 7 different zones, all in the month of February. And so quite a task for everyone, including our Solon team. We think did an incredible job in presenting to our residents that were present. As indicated earlier, some of the sessions were better attended than others. I think we did a great job of outreach. Just, you know, some of it, I don't know if it's daytime, nighttime, or whether it ends up being high priority or not to residents. But nonetheless, I think we gleaned some great information that someone was able to capture. And I love the way the team works together, because I think they captured the kind of feedback so much better than what we have done in the past when we've worked with strategic planning consultants. So the whole team effort was just extremely appreciated, and I think very successful. And we will see those inputs coming through in updated reporting that we will be receiving from Solon, and then also be working through in our next board workshops later in the month of March. So if there's any questions, happy to entertain those, but just wanted to give a quick highlight on the completed sessions.
Will we be continuing in any way to hold community forums outside of the strategic planning process? Obviously not 7, probably a month, but just so we can continue to hear from the community and what kind of feedback we're getting.
I think we have, you know, based on the QR codes that we presented, you know, the kind of information that continues to come in from those. The only formalized plan that we have for continued engagement is with the virtual session on March 4th. But we're always open to hearing any kind of community feedback. I mean, the workshops are also welcome to the public, and those are publicized and communicated as well. So, you know, we're always looking for that, you know, additional communication and input from the community as much as we can. So.
Just my thought is it could continue to be useful, especially as we try to track how we're doing, what things are working in the community. We also, along with getting the numbers and all that type of thing, we want to make sure we're hearing from folks over a period of time, maybe. So, and I think that.
Are you talking beyond the completion? Okay, I'm sorry.
Yes, beyond completion.
I missed that. My apologies. Yeah, so there, it's not specifically planned yet, but yes, there is the idea that we will continue doing work to track the outcome and the progress. And also I anticipate we'll continue doing work with solar. I'm hoping because I think they're really good at their at, you know, electing everything, being able to condense and consolidate the efforts that we're.
That's great. I was gonna say great input, and I think that is something that should be decided within our strategic plan is those benchmarks, right? When are we gonna check on it, if it's either the first year, year number 2, do we want it to be every 2 years? So I think it should be incorporated within the plan, so. Any other questions about? Next item.
Okay, next item B is just included in the packet is the draft budget for 2026 Healthy Desert, Healthy Youth Summit. We did give a brief highlight at the last board meeting, and a lot of the theme of this year's summit will be related to our social determinants of health. So this is just a draft budget. We brought it to the finance committee so that the board is starting to see what the numbers are potentially looking like. We've got a budget of about 170,000. Included in that on the revenue side is 100,000 that we'll be asking from the district board to approve, and the approval items will come to the March finance and board meeting. Also included in the budget is a $45,000 contract that we'll also bring to the March meetings for the Hawker production team. The efforts that they've done with us in the past, I think, have been good and successful. That it's not increasing over the prior year amount of 45,000. But this is informational at this point. Just if there's any comments or anything that we will be bringing in March, the actual request for the budget, as well as the contract for Hawker Productions, as well as seeking approval for the 100,000 from the board as the presenting sponsor.
Any questions or comments on that item? Alrighty. Tina, you proceed.
Next item C is Chief Administration Officer salary adjustment. This was brought to the Finance Committee earlier this month to communicate that the CEO was intending to provide an increase to the salary compensation for our CAO. Initially, when the CAO was promoted from the accounting manager position, promoted at a lower level than what the actual salary range was for the position, but it was set up as a development program. The CEO and CAO have been working on that development program and feel that it's appropriate time to be able to increase the CAO's compensation or salary to the low end of that salary compensation range. So it's was modified to an information item.
So is that included in this year's budget?
There's money in the salary budget for it. It wasn't specifically defined because we started out with, you know, what the salary was, and then there's the merit increase, which took place, which gets to the 166,000. But at this point, I feel it's appropriate to increase to the 175,000, which is the very low end of that CAO salary range. And then it also puts it much more in line with the management team's level and much more appropriate for where our staffing compensation needs to be, especially as we go into our compensation study that we will be working with the board approved at the last meeting. And so Hope that answers your question.
Any other questions, comment?
Congratulations there. Well, sir.
We have to take action on that?
No, we think that the information alone.
All right, seeing no other comments, or questions, we can go ahead and vote.
Item D is the CEO engagements and district media visibility report. If there's any questions or comments that you might have, but the report is in the packet.
If I mean, President?
Yes.
I just appreciate the email that you sent to provide a little bit more information about the meeting and Supervisor Perez, so thank you for doing that. It was very.
Thank you.
If I can expand on it a little bit, like, is there next steps? Do we do like a ad hoc committee to the board to discuss what was discussed, or especially the issues with the revenue aspect of it?
Yeah, I mean, I think it might be appropriate maybe during our workshop for strategic planning, because the way I see this, you know, if the supervisor is really looking at opportunity, which he is, that's gonna need to be built into our financial planning too, because I almost think we need to earmark that net property tax revenue as county money. And then anything that we do additionally with grant funding and projects, real estate, et cetera, is a separate bucket.
Right.
So, and, you know, we may not have specifically identified what might be presented from the county and Supervisor Perez. That remains to be seen.
Yeah, because you know, when the expansion was originally approved by the legislature to go to the vote, the initial discussions were that both the congressman and the supervisor would then look for some type of revenue source. And that was actually supposed to be in the discussions before the legislation passed.
Right.
And then went to the voters and the voters passed it, and then that discussion just went away. So I'm really happy to see that he's willing to start that discussion again.
And honestly, he acted like he didn't remember that.
Yeah, when you sent the email, I was in the office at the time, so I'm like, we've had this discussion many times before, so. Yeah, but I think it's something we need to pursue, it's. Because I'm actually here as someone from the West Valley.
Right.
There's still some consternation out there about, and if you're looking at where our grant dollars are going. There's quite a considerable amount more going to the eastern side of the valley than the western portion, so there is some concern.
Yeah, and so when I talked to him more specifically about the property tax component, he really wanted to understand why we did not receive that additional money.
That was his job.
I agree.
And not his per se.
But yes, but
I should have been in discussion with the executive office of the county.
Right, so, you know, so I think he's a little bit incentivized now, because what I shared with him is that. Because he also said, I don't understand why we don't get all of the access to all of the property taxes, and I said, well, there wouldn't be, you know, the staff or the operation of the district without a portion of that being used to provide. But I said, if there's additional property tax revenue that comes out, like perhaps should have with the expansion, or whether it's incremental increases or a share of the pie, that, you know, any increase we get to our property tax revenue, obviously that benefits you and the county, so.
And I didn't mean to go down that hole there. So
He said he's very open to discussion on how we can maybe work with the county in doing something.
So I'm glad you did bring it up a little bit more, because that's why I think it's very interesting that we then kind of got buried in your report. But I think it has so much more potential, because as we are hearing the comments from the community in our strategic planning, our community engagement meetings, there's interest in a hospital in the Eastern Coachella Valley. So if something like that is going to happen, and we should make every attempt to see how does that work, then there is going to have to be the consideration of the county making some financial arrangement, you know, if they, so that conversation needs to take place. So it can happen overnight, but we need to start talking about it, so.
I figured it was extremely perfect timing, the way that.
Yeah.
Came up during that conversation.
Yeah, and I would just encourage you, Chris, is that I agree that it should be part of our strategic planning discussion. But I think we do need to continue the conversation with the superintendent.
Beyond the tax revenue.
For what it's worth, I think we have some great ideas. We could fly, and I think should be, that we discussed right there.
And I think the incremental tax increase is probably one of the best options.
Yes,
Because it's less that the county loses per se.
yes.
Well, and it gets less of an imposition on the other communities that receive the allocation.
I mean, that was our goal before.
Yeah.
Okay, that was really the goal, we felt that was appropriate and fair, and then we used to have, we had some buy-in.
And, you know, bottom line with it, you know, we couldn't increase, or we couldn't get the expansion done without a revenue source.
Right.
So then we had to carve out that 300,000 from non-tax dollars, so.
Perfect, any other questions or pro calls? Alrighty, up next, Mr. Jeff.
So I know you'll all be very disappointed, but I don't have any.
Next.
Alright, moving on, I sponsorships. First one, Growing Coachella Valley Vision Tour.
Okay, we did not have a program committee meeting this month, so these are all being brought fresh and new to boards. So the first one is for Growing Coachella Valley, it's an activity we're with the Coachella Valley Farm Worker and such, so this. That reports up. Well, I don't want to get a little.
Yeah, it's Ag Vision, that's a collaboration between the city of Coachella and Growing Coachella Valley, who represents numerous growers throughout the Coachella Valley. They are gonna be doing a tour of different growers and their facilities to just kind of, you know, showcase the great work that our growers do here in the valley. And it's gonna be on February 27th. They're gonna be chartering buses, and they're gonna be doing multiple stops throughout the eastern part of the Coachella Valley, and just you know, that's in a nutshell what it is, yeah. And Growing Coachella Valley is a great partner of ours. They're our main partner, like we do the deployment of our mobile medical clinics with the farm workers. They're the entity that opens the doors and makes the warm introduction to numerous growers that we have been working with since the onset of COVID-19.
And their letter requests us sponsoring sponsorship for 5,000, so that my understanding.
Yes.
I have another question. So the event is in 3 days. Does it make sense, like if we're gonna be sponsoring? If we're gonna be, you know, like. One of the sponsorship levels at 5,000, they're saying that will be on other digital and print media, so that's just gonna be 3 days if it's digital. And then I don't know if they've already printed their material, are we gonna be included? I mean, also whether like their packets. And then also, I didn't see here, are we invited to the tour?
Yeah, they do have tickets available through Eventbrite. So yeah, so we could
So
ask
nothing included?
Selena. I believe so, yeah, I'll get this the link from Selena to send it around to you guys.
Yeah, and this is a good example of why we have modified our sponsorship policy, because we are getting more and more sponsorship requests in the month of the actual event, so it's creating these kinds of issues and questions. And so, you know, we're trying to do our best to support organizations, but you know, for it to be done appropriately, obviously it's better to have the review and approval before the event. And so these next 2 or 3 months we'll be doing as we're doing presently, or if the board guides not to consider approval or even bringing to the board, that's acceptable as well. But the new process will begin in May, that we will be requiring any events that are being asked for sponsorships beginning July through December will need to come to our main program committee board for approval. So we're just getting through the next 2 or 3 months on a monthly basis. And we'll be doing much more in advance and requiring organizations to meet our schedule and not kind of put us in a situation that we're in.
Yeah, I have the same concerns, and this is gonna come up in the next one as well, but it's that. At the level that they're asking for, that there's no way feasible we're creating in 3 days. Additionally, at 5,000, we're basically funding a quarter of the entire budget. And don't get me wrong, I'm well aware of growing Coachella Valley, and it's a great organization. I'm happy to sponsor at last year's level, but not at the 5,000. This month.
Any other board member questions?
I will go along with that. I also had the same concern about how much really exposure we would get. But it's also about supporting the event and partnership that we have with the organization. So I do think it will be a worthwhile partnership. And also if we're able to capitalize on it by taking our own camera out there and using that as one of our features about how does that connect to the work that we do. So if we could take advantage of this opportunity that they're giving us to get some footage and connect it to how does it get from the fields to the table. So we could look for creative ways to make it work for us, since there's very limited time here. But I support the board's comments about a reduced amount at 2,500 maybe.
Alejandro, you have a comment?
Yeah, I just wanted to clarify that the request did come in after the Coachella Community Forum, so it was 10 days ago that they sent this information out, so I just relayed it through the proper channels to Chris. But yeah, I agree, I think given the time frame, it's not enough exposure for us to really get our name out there, our marketing materials, etc.
Well, I'll make a motion to approve the community cultivator sponsorship 2,500.
Can we ask for spots for either staff and have it be open to the board as well to participate or be part of the tour?
How many board members would be interested so I could make that?
I'm not available.
When is it?
It's Friday.
I think if at least someone from staff could go, I agree with the.
Or we'll be at California Care Force. That's another event.
We will possibly be able to go, or you go.
Or even if you have
Selena's in the pictures.
Yeah.
the what's his name, the guy who's always.
Marcos Palma.
Oh, Marcos.
Yes.
But if you could give us some footage that we
Yeah,
can use for
that would be
our
good.
program.
Definitely.
That would be great.
So no staff or board are interested, so I don't need to get the event right link from Selena.
I'll give it back to you.
Let me know.
Check out the calendar. Right, thank you. So we have a motion and a second.
Second, Director Brescio.
Roll call, please.
Director Smith,
Yes.
Director Rogers.
Yes.
Director Perezville.
Yes.
Director Longston,
Yes.
Secretary Delara.
Yes.
Vice President Rodriguez.
Yes.
President Barasa.
Yes, thank you. Next item, the Don't Mind Me Foundation, Mental Health Gala and Golf Tournament.
Again, this is one, that's a short notice one, the actual event is February 28th, March 1st. One is the Mental Health Gala and the other is a golf tournament. March 1st. The last year, we provided, or the district provided $5,000 sponsorship. And there's not a specific ask, but that's the amount that was provided prior year.
Any comments from the board? Questions?
Well, yeah, just looking at it, I think there's only 10,000 or 5,000 available, right? Right.
Yeah, again, same concerns about.
Yes, agree with you. I just don't know why we're getting so late. We did this last year with them. Yeah, it's like 4 days, and I'm not trying to shoot you, I'm just answering a rhetorical question that nobody here can answer, it's just. I think we gotta figure out, like, this isn't a last minute money request, like, we want a chance to market this, we want a chance to be in front of people. 4 days is, I like the organization, but come on, guys, like, run a professional organization and like request money months in advance, you've had this thing booked for how long? And you're scrambling to backfill money, that's the way it's viewed to me.
Well, I think what's happening is that, the word's getting out that hey, the district has money and they're getting lots of sponsorships, so hey.
I think it'll be way to policy.
And so that's what's really kind of encouraged our new sponsorship policy, so that we can be more responsible for the resources.
I think we gotta look at it more like a grant a little bit, not in terms of as vigorous, but like have a little heads up.
That's what the new process is going to be. Staff is also working on an actual application form. So what you will see beginning in May will not be just this staff report and materials, it will actually be a full application where the sponsoring sort of the institution will need to get more specifics as to why they are asking for the sponsorship. And we're also asking, and we'll present the application at next month's program committee, just so that people are seeing it. We're actually bringing it through our Founded program so that the application will go through there. Founded is how we do our grant process, so it's going to be much more formalized than the present.
That's the question. Did I read correctly? If I'm wrong, in the budget, is there $15,000 left for sponsorships? Or did I not see that?
So I think
It's probably more. Okay.
Yeah, there's
Left for this fiscal year, okay.
but it's a good point about, again, on your budget, how much do we wanna participate in sponsorships? I think that comes to what you think you can get out of marketing, because what we heard at all these listening sessions, at least mine, is that. The marketing, these could be very good avenues to reach people, especially if we can get onto their social media. Apparently TikTok and YouTube are like the hot items to get information out. So I think when we reach out to these people, just our feedback has been at these listening sessions is that we want to be on your social media. Like, this isn't going to do anything, and it costs money. But if we could, hey, we want X amount of posts about our healthcare district, we want you to interview somebody here. Something like that, because what we found was that in social media, it's everybody's access point. So I think when we look at these sponsorships, part of that policy should be like, this is our part of our marketing budget to get our name out. Yeah, we want to sponsor these organizations, but what's their reach? Are they reaching the communities we want? And then how do we get involved in the marketing? It has to be social media, it has to be Facebook. That's where everybody's giving us the feedback.
and that's kind of more what I'm keeping an eye on with these sponsorship requests. Not always about the table or something like that, but how we can benefit from outreach, or is the event that they're actually doing.
And it's really about how we access our patients here, and that's really what we're trying to figure out. Like, this ag group probably is the best access point we have to actually meet people we treat. Like, this gala is probably not, because I went last year, a lot of people came in from LA, which is great, they can learn about what you're doing. It's a different those are people you may go request grant money from later, so I think we need to be a little more strategic, like I think what Greg was getting at on how we approach these sponsorships.
Well,
In the next fiscal year.
right, and also, I mean, it used to be that we were more focused on the organization having a health nexus. I think we really kind of got away from that in a way, but if it also helps promote, you know, the awareness of the healthcare district and the events that are going on.
I think bringing Will into these conversations about how that looks, where he thinks the best benefit would be. I mean, we're spending a lot of money to go market on TV, but maybe we just need to get on somebody's very popular YouTube channel, and that's better than spending X amount of money with the TV, you know, to get TV sponsorship. So just something I think we really should think about.
Thank you for those comments.
Yeah.
So the question is, do we wanna sponsor this now at what level, or should we just hold on
So
for the sponsor?
I agree with Director Lux. However, this has a direct nexus to healthcare. And I've met with these people on a number of occasions, and their vision for what they want to build in this valley is amazing, especially for behavioral health. I agree with the timing and all that, but I'm actually gonna move that we sponsor at the $5,000 level.
Second.
Thank you for that. Roll call please.
Before board comments,
5,000?
Do you wanna?
What do we get?
board comments and after public comments, you don't. But
And then,
my comment is I'm actually gonna vote against it because I would like to vote for a smaller amount, just to be fair to the other one and this one. So this is why I'm gonna vote no on the 5,000 level. Thank you.
Any other comments?
Yeah, that. And I might also, and I agree with what Greg is saying, like the mission alignment is definitely there. I lost my place with this, but what they're actually fundraising for here. Where is it? Crisis Intervention Scholarship Fund, as well as a mental health recovery center, Palm Springs campus. So I mean, we might encourage them also to apply for, you know, grant or something, you know, because I understand this is an event, but they're raising the money.
they will.
Right, but you know, there's more space there, I guess I could say, than this maybe in the sponsorship, so just putting that out there, that is mission.
So would you consider? Would you consider amending your motion to 2,500 instead of 5,000? I mean, I'm sure that they'll take.
Yes, I mean, what's the Director Lawson point, are we gonna get anything out of $2,500?
Yeah, I don't.
I mean, is the logo in the pool or, you know?
You better be there that night.
But then again, the event is in 4 days.
Yeah.
Is anybody gonna go?
I would go.
If we do give 5,000, what will we be
I mean,
getting?
I think in this instance, we're not.
So if you wanna answer it, so.
No, I know,
That's what I was
but
gonna ask her a question.
it's the same thing, like I already know what they say that we're gonna get for 5,000, but it's 4 days. How they say it's 4 days remaining, right? How much can they do of that? In the 4 days? So it's not gonna matter if it's 2,500 or 5,000, we're still gonna get the same effect because there's only 4 days left. That's what
I think at this point, I don't think it's about the marketing component. Because we know with the remaining amount of time, I think it's about whether you wanna support the organization for their mission.
So I'm happy to amend the motion to 20.
Would you seconded it, right?
Yes.
Would you be okay with seconding?
I'll change my second.
Roll call?
Director Smith,
Yes.
Director Rogers,
Yes.
Director Perezco,
Yes.
Director Lawson,
Yes.
Director Delara,
Yes.
Vice President Rodriguez.
Yeah.
President Rossi.
Yes. Thank you. Next item, Rancho Mirage. Chamber of Commerce, State of Healthcare, Shaping Healthcare Today and Tomorrow Vision Strategy AI into Global Perspective.
Okay, so this one is a yeah, so this is the Eisenhower folks that will be giving it was actually a great presentation if it's similar to the one that Donna and Alejandro attended. So I think it's a great communication related to healthcare. So what we're asking for here,
So the 5,500 level is sold out.
yeah, so the next one is 132. Yeah, so the wellness partner sponsorship. Saying sponsor, with program sponsor, sorry.
So there's two at 3,200. One of them is the wellness partner sponsor and the other one is a program sponsor. So one of them would give us 10 seats, one table, 10 seats.
Yeah, that was the one I think that that we were at least talking about, was the wellness partner. Thank you. With the table, we can.
I'll move approval for that, for the wellness partner sponsor, that was 32.
Second.
Any other additional comments? No? Yes,
And something that's just to kind of, or to address Dr. Smith's question on last, which is, for all the sponsorships here. The 15,000 you're talking about was, what we were under year to date, on the 250,000 total yearly budget, so, we'll still have about 20,800 each month for the remainder of each month, so right now, just with the two we've gotten, we're only using 5,000 out of that. Plus whatever else might be.
How much was the actual today?
Yeah, actual to date as of the end of January was 130.
About 250,000.
thank you for that. We have a motion and a second from the second, roll call please.
Director Smith,
Yes.
Director Rogers, Director Perezkiel,
Yeah.
Director Logston.
Yeah.
Secretary Delara.
Yes.
Vice President Rodriguez.
Yes.
President Baraza.
Yes, thank you. Next item, the future Coachella Valley 9th annual The Future is Ours celebration.
Yeah, so this event is March 6th, and we have sponsored this event in the past. At the $5,000 level, they are requesting $10,000 fund.
I would move approval for $5,000.
Second. Which one?
The five community champions.
Yeah, that's what we did last year.
Thank you.
Again, this is short timeline again,
Yeah, I'm surprised that they waited so long.
especially them,
Right,
Yeah.
yes, it's usually way ahead. Usually,
and they're a great partner, I mean, it's,
they are always supporting, yeah, I'm surprised with them.
Alright, our report says $10 tickets. I'm assuming that is
I
meant
think
to
it's
say
10
it's 10 tickets. I was like, with that amount, let's get ourselves 500 tickets.
I'm sorry.
Okay, roll call please.
Director Smith,
Yes.
Director Rogers.
Yes.
Director Perezkiel,
Yes.
Director Logston.
Yes.
Secretary Delara,
Yes,
Vice President Rodriguez.
yes.
President Baraza.
Yes, thank you. Next, Transgender Health and Wellness Center, Trans Pride 2026, Empower and Equip.
Okay, so this is just a request to support the stage infrastructure sponsor for their event.
With $10,000.
Well, it was a total of several
Several
sponsorships, yeah, so there were small amounts, but total.
I would move to approve the request for $2,300.
Second.
Thank you. Any additional comments? Roll call?
Director Smith,
Yes.
Director Rogers.
Yes.
Director Perezkiel,
Yeah.
Director Logston,
Yes.
Secretary Delara.
yes,
Vice President Rodriguez.
Yes.
President Baraza.
Yes, thank you. Next, the Jocelyn Center 16th annual Jocelyn in Blue Fashion Show luncheon.
Okay, so the district has sponsored the Wine and All Jazz event this past year for 5,000. And then we have provided prior sponsorships as well. This is. They didn't give a specific request, so the levels are 1,500, 2,500, 5,000.
One gives us the table, 'cause I think we did a table last year, right?
Did you model?
I don't remember. Photos of that, I'm not saying proof of that, but-
Well, then it's my turn this year, so.
Definitely have to go. Oh. Do we know what we did last year?
That's fine,
Yeah. Five thousand.
I move that we donate 5,000 with the. What is it sponsored? Gadism?
That is.
Donate for $5,000.
I'll second that.
Any member comments? No, alrighty, roll call.
Director Smith.
Yes.
Director Rogers.
Yes.
Director Perezio.
Yeah.
Director Logston.
Yes.
Secretary Delara.
Yes.
Vice President Rodriguez.
Yes.
President Barraza.
Yes, thank you. Next, J committee meetings. First one is Finance, Legal, Administration and Real Estate Committee. Director Lawson.
Awesome. We discussed a few things, you have the draft meeting minutes there, I think the two biggest things we discussed that we're bringing for action. The first one is the DPMG Health Public Clinic, 5-month service agreement. I don't think we have their audited financials, and that posed a little bit of problem, I think, for us, but, we've reviewed a bunch of the information and are recommending that we continue the service for 5 months in anticipation to get the audited financials. Great.
And get a full grant application.
And get a full grant application in. So. Are there any comments about that?
No, we do have representatives here from DPMG Health. Leave that comment.
So waiting for the financial audit
Yes.
So,
for the grant,
after this one.
yes. So the grants actually will be to your guys tomorrow is what, and I have to apologize, we have been so busy opening up a new pediatric center that we literally took all the not that the street medicine was not important, very important, and we wanna keep on growing. But we had some additional thing that we really wanted to integrate it. So that's where the delay is, but it's 99% ready and it's on my desk. So I will review tonight and then have it to you guys first thing in the morning and then again, my apologies.
But just to make note too, to approve the grant, we will need to have the audited financial statements.
I thought we did that, we need that.
You need to do that each year.
I was
Yeah,
not.
so you need to have current annual
Audited financials.
Okay.
Okay.
Just to clarify, this, from here all the way to the end of the fiscal year, this will be the services contract. The new grant application will take place starting July 1st moving forward, right?
And we need to make sure if we're gonna continue services, which we want to, that has to be done in advance to get time to review the audit. So like,
I'll make sure I'll cover it, yeah. No, I think it is, cause.
it is a rush.
My time, yeah.
I'm saying that the grant application.
Oh, well, they need to get it in and get it processed.
Yeah, so my goal was that to have the grant concurrently, so that I have plenty of time to make sure that it gets activated. And so I didn't wanna just rely on our current the vendor agreement to pay that, because we're also gonna be really busy with that too. So we don't wanna grant on.
Yeah, so I think the purpose that we did the vendor agreement is to help supplement bridging the gap.
It's giving you time to get this
To the
done.
new,
Yes, thank you so much for that, yeah, absolutely.
And any other questions or comments?
I move approval of that leaders.
Oh, hold on.
Yeah. Raise it and move.
Wanna just to confirm that, there's no changes to the level of service,
No,
the cost. Everything was pretty much just an extension of our current grant, is that correct? Okay,
it wasn't a grant, it's a vendor.
oh, vendor agreement, I'm sorry, the agreement. Yeah. I'll second the motion.
And for me, I do have one, we had asked about the RFPs or when some of these agreements, do we have an answer on that? The question that came up during our agenda review. There's a
as
threshold,
far as you gave RFPs for this
for
work.
like services, I just wanna make sure that, we have a policy in place that says that if we're gonna contractor service that exceeds a certain amount that if it has to go out on an RFP, that we're not bypassing that. So-
Also, we did do original RFP for when we started the mobile clinic. And there were not, I don't think we got any other, because that DPMG was only one, so operating. And Jeff can answer this from a legal perspective, but I think we're allowed to be with the specialized service. Because we.
Yeah, but it.
I'm like, Jeff is in a real.
What are you saying? Yeah, what are you saying? Correct. Okay, we went through the RFP and there's a lot of discretion in that RFP process, but it's good, sound government to make sure you're doing an RFP process, so.
Yeah.
And it's a question that came up during our agenda review and which I mentioned that I didn't even answer on the spot, but was hoping to get an answer.
And we do.
No fish answer, but.
We do have a policy that does define like professional services and things like that.
But like, what
I think we need
do
to.
we have one that show like the threshold on the amount? I know that typically that's one of the.
Yeah,
main things out
but
of-
I think we need to do some work on developing some more policy around vendor agreements, because we haven't traditionally done much with vendor agreements, so. Eric and I were talking and believe that we should bring some new language to consider for the policies coming in.
They're already policy committee. Okay, so, but do we have anything in here that says it's tied to an amount?
It focuses on the professional services like architecture and construction management and others that do with public safety. Those are defined in there when they reach a certain threshold to bid out, but as Chris was noting, that with these types, they aren't specified in our current policy of this type, and so it's something we could explore.
Out of curiosity, what is the threshold for those other services?
Those other ones usually focused on 100,000. The references. Pulled up here, sorry.
All right. I do think we need, while he's looking that up, I do think we need to explore that, what you just brought up about RFP, and I think we really need to be defined about what the amount is, when does it hurt, when do we clear that hurdle? If people offer a specialty service that isn't offered other places, maybe they don't have to go through the RFP, but I do think you need a very good mechanism, like you're saying, to like give everybody an opportunity to compete for the same work.
And we do have policy, it just needs to be expanded more for this type of work.
And for the quantity and amount of work we're going to be doing in the future, I think you have to have that process.
And if we're gonna be looking at more vendor agreements like.
We haven't really done a lot of vendor.
No, it's exactly.
And so, yeah, I think you have to understand that sort of the historical. That the whole planning needs to be operated, so we basically contracted with DPMG to do that, okay? I think that you're better served in the future to go through a grant process so that you could evaluate the applications and to the extent that you find that it makes more sense to go through another RFP process, you could also, do that. But I think we want to stick to the grant process to the extent that we can. I think you're better served in that context rather than vendor agreements. But this was a little unique. If we had this mobile unit ready to go into service and we needed to get somebody to come provide the medical, comprehensive medical services for it.
It was 50,000, I was thinking on the public works was focused on 100,000, so. The professional services and we align with the government code on there in terms of those professional services. It would be RFQ or 50,000 or more.
Yeah, that's the number that keep to mind. I know that's what like municipalities do. Okay, so we have a motion and a second. Any additional comments?
My comment would be if for tonight's action, I'm totally in favor of moving forward. But I'm just wondering, I don't want the applicant to submit their application and then for us to kind of have to be dealing with it and responding to the application. I think we need to decide whether we want to do an RFP or I think before they actually submit their application, so that way they don't get started. And if it's okay that the board says we don't wanna do an RFP at this time. That way they can move forward and get through in a month or two, rather than stop them when they already had 2 meetings and then have to start over. So I think we should make a decision at some point, maybe at the next meeting, because they have 5 months to deal with this, and then we can decide whether we be proactive, whether we want to do an RFP or not.
And then also, we do have a deadline for grant applications. Right, within this fiscal year, within this strategic plan. So.
Well, I think that the new grant would be for next fiscal year, and that's why we're doing this through June. So then they could apply for the grant that would be
So they would be applying.
coming in July.
And I'm not comfortable keeping it as a vendor agreement and not as a grant, but I would argue against going out for an RFP. Well, the only fact is they're really the only ones playing in
They
this
were,
year.
but I don't know if they still are.
And they are, they are, yeah, if we contract them with the counties, because we can't find anybody else out there, also too, is like when. Just related to how we contract in the county and other municipalities, is like. You do an initial RFP for a vendor or service, and if they're performing at the level that you like, it's very common you just renew. That we don't go out for an RFP every time, it takes a lot of staff time. It creates uncertainty for the organization, and we cut down on services. I'm fine if we want to discuss it further at the next.
I just think we need, whether it is or not, I just think we need to decide, be proactive rather than reacting and being unfair to the applicant. So whether, I don't know, if we could do that tonight or we need to agendize it, but I would like to be able to get some clear direction to the applicant on how they would proceed with their future.
So do you believe that we can either maybe approve this item, take action on this item with direction, including that maybe within 2 months, we get different scenarios of like different pathways that we can.
Or next month, it's gonna be next month.
We can bring to section A committee or with discussion. Really, it's about whether the board wants to consider doing an RFP or I think is what you have. But we get direction from the board collectively, with the staff can bring that on the next application.
We'll go with that down, you can see how the question is, how to raise first, and then we'll go with you down.
Yeah, for the question that if anybody else out there could do it, we do have, an example of where we had in the Desert Highland Gateway community had contracted out with DAP Health. For just one time a week for a couple of hours, but they were struggling to meet that commitment. With DPNG House, we're out there 3 or 4 times a week. Now with the addition of pediatric clinic, all 3 school districts are very excited to be able to now to have those pediatric services with them. So, looking at, I said, federally qualified health centers here in the Coachella Valley. I don't think there's one that could actually provide the services and have the capacity that DPNG Health has to be able to do the sports physicals. Because it's not just 1 or 2 providers. When we do sports physicals, we have upwards of 8 to 10, if not more, providers out there, seeing the children. With the vaccination clinics, our previous grant, we were able to establish a pharmacy. Now they're able to be enrolled in the Vaccines for Children program that we utilize to vaccinate our underserved children throughout the Coachella Valley. Their primary care, our on-house outreach that we do at Palm Springs Navigation Center in the city of Desert Hot Springs, and Martha's in Indio. So I think for us to find somebody out there is gonna be very, very hard to replace. They might, have somebody out there that might be able to do 1 or 2 times a month, but not 3 or 4 times a week where we have, and the Pap smears. That's another service, and not the level of service, not the level of capacity and staffing that they have currently. It's gonna be very hard to find out.
You can also do a request for qualifications, so that way you don't have to do it that way. What you're bringing up actually brings more questions to me as to whether you say if, first you said there wasn't, and then you said if. So I wanna know, is it an if or is it a for sure?
I think there is.
Okay.
And for me, it's not, I'm not coming from a place where I'm questioning the quality, right, of their services. It's making sure that as a board or public agency that we're doing it the right way, or the best way possible. That's more where I'm coming from rather than questioning their actual services. Donna?
I just wanted to clarify a little bit, like first block, the mobile units, the first one. We did, that's what Jeff was saying, we went up on RFP, and there wasn't anybody, so that's why we did a vendor contract with DPMG. They did not have a lot of financial, so they could qualify for a grant. I also want, then we had a grant, it was almost a 2-year grant, the other was a 2-year grant, met all the deliverables, and so I think through the grant process is a lot cleaner and a lot more in compliance. But again, this is just a stopgap right now for 4 or 5 months. However, I just wanted to make, with DAP, that was part of a grant when we inherited when they inherited Borrego, so they didn't have a vendor contract with DAP to do the molding, so that's still part of the grant as well. They had some difficulties, but anyway, I just wanted to say, I think grants work really well with them and with anybody, especially if you're gonna be doing something large scale like that.
And we would also love to have entertain the island community. We would love to be part of that, and we have made arrangements. We've also obviously learning the street medicine aspect. That's basically who we are. That's our primary line of business, and so we want to continue and grow. And if I have an opportunity to work with you guys to actually expand to even Mecca and Desert Hot Spring is another area that would really help with. And instead of doing 2 to 3 events per month, because we're out so many different areas, we would love to focus it where we could be out in a particular location 3 to 5 times a week. And we see so many more patients. Just even our grant alone, our first grant, we saw 12,000 visits, I believe. Second one is 15,000. And so we were exceeding any brick and mortar clinics, any QHCs, any other component that the lives that we touched. And now with the pediatric and mental health services that we've grown into, I think that could be also an extension. The pediatric was a venture that I thought that we would never get into, but it just made sense to really partner with the school system out there, because we were already doing their sports physical, providing vaccines. So we would love to continue with that. So we would love that opportunity to keep on going, but I don't think it's wise for us to keep it at the 2 medical. We need to expand because of what's happening with the government, with all the pay cuts. Even at our brick and mortar clinic, we're losing thousands of members that we've taken care of, and the members don't even know. So we would love to extend the street medicine aspect, where we could go out and.
Madam President, I think that we are just dealing with the issue today and can deal with that issue after next month when we decide on how to proceed. If it's okay for us to continue with the vote.
Yes,
we have a
seeking
motion
it
and a
as a
second.
public comment or.
I hate to be the but I think once you decide, it's always good it's always healthy to have an RFP process. But once you decide and you find an organization that's going to provide these types of services, the grant, I just can't emphasize enough, a grant process is so much better because there's monitoring, there's deliverables, there's all kinds of things that that really I think is a preferable way to go. So.
And this was just to bridge the gap, be able to go this route.
So for 5 months, continue on. I think that's the motion on the floor. Do you need a motion?
I believe that we did you catch that, Kendra?
Yes, Director or Vice President Rodriguez and Secretary Delara.
Alright, perfect.
Director Smith,
Yes.
Director Rogers.
Yeah.
Director Fresco.
Yes.
Director Logston.
Yes.
Secretary Delara.
Yes.
Vice President Rodriguez.
Yes.
President Barraza.
Yes, thank you. Our next item, Desert Hospital Retirement Protection Plan, close out.
So did you want to take this one?
Yes, sir.
Okay.
So I would say that our new CAO here has done a great job, along with Chris, helping us close out some of the loose ends that we've had since we've stopped operating the hospital, wrapping up some of the employee, I wouldn't even say the risk, but just things that have been on our plate that we had to kind of manage on the side. So one of them is the retirement plan that we've been looking at options about how can we move this from the responsibility of this healthcare board, which no longer is really directly involved in the function of the hospital, and put these people in the care of a plan that would be more appropriate. And then it becomes something that we don't have to focus on. And so the plan here, I think what they've been able to put together, yeah, you have it up here, is a firm that will help us move our current funds, which are about 4 million total, right, Eric? Something like that, and about 2.1 of them is allocated to the existing members. So this firm here that we found for, I think it was about $65,000 plus whatever legal fees. Would be able to take over those funds, manage them for those main employees until they retire. Eric, add to any of that.
Sure, yeah, the main thing is, the first step would be to send out notices to all participants to encourage them to cash out. And that way it minimizes the number of participants, and then from there, it can be transferred to a third party to administer, it shows to take annuity. The main element of this is right now on our balance sheet, we do have, $2.1 million asset on there, and really the only way to access that is once the plan has been complete. And so in this process, about 65,000 is estimated, because they have to make an assumption on who will cash out, who might do it. And then about 15,000 is the estimate from legal counsel right now, to handle the changes of the plans with the IRS and helping us to review the processes that it's gonna take. They're referencing that a lot of those should be able to be paid out from the plan assets, so it wouldn't end up being something we have to pay out for, but the way I noted it here is just estimate of the 65 plus the 15,000. And then we can coordinate that with the budgeting that into our next year's budget, and then whatever they can take out of the plan would then reduce the actual expense.
Thank you.
Just a couple of thoughts. This goes back a long ways, and to me, it's remarkable that there's still about 100 employees over there that are still working for 30 years, number one. Number two, the district board many years ago had the foresight to fund this, to make sure that the money was there, so that we, for public agencies, a lot of times they don't fund these plans, and so they end up having to scramble at the end. And they had the foresight to do that. And then the third thing is, I think I'm so glad I lived long enough to see the end of this plan.
Say you outlived the plan.
Any questions, comments on the board?
Move approval of the recommendation.
Second. Thank you. Roll call, please.
Director Smith,
Yes.
Director Rogers,
Yes.
Director Perezquio,
Yes.
Director Logston.
Yes.
Secretary Delara.
I will vote yes with the staff recommendation, but to include the dollar amounts, 65K plus the 15K for legal. That wasn't included in the staff recommendation, so the staff recommendation is consideration to approve the CEO and to take appropriate action to close out. So I just want to include the dollar amounts for transparency purposes.
Yeah, sure. Title of the motion,
Okay. We'll make just make the change with the balance, I think.
We got it.
Yeah, and I mean, Stewart has estimated it's gonna be 15,000, and we've worked with David Wright for Maine for the last 30 years on this plan, so it's probably a good guess, but.
So should we increase it to up to 20 or?
No, we're gonna do that.
We're gonna be fine, you probably know these things, so.
I was about to say, like, we're in the middle of the vote, so I don't know if
Yeah.
we're going back to. public
So just
discussion.
for clarification, the maker of the motion of the second, are you okay with including the
Yes.
dollar amount?
Yes.
Okay, so then, do we need to start?
No, you have that there, okay, so, so.
No, but the calendar has to be, yeah.
So Director Smith,
Yes.
Director Rogers,
Yes.
Director Perezquio,
Yes.
Director Logston,
Yes.
Secretary Delara.
Yes.
Vice President Rodriguez.
Yes.
President Peraza.
Yes, thank you. All right, then the next two items, legislative policy committee and program committee did not meet to select a quorum. Any questions? I don't know, there was nobody, okay. Next, board member comments?
I have a comment. This is probably gonna be a pretty big comment. I don't know if Alejandro, are you gonna do a report on the,
Yes,
for the foundation or here?
on the foundation side.
Okay, then I'll wait until the foundation.
All right, so no comments, we're gonna go ahead and adjourn. the meeting.
Excuse me, President Peraza would like to adjourn the meeting in memory of
Yes, but then.
One short comment, at one point in time, we had a policy where we could appoint alternates to those committees. And I was in the process of going to attend it, and had I been nominated as an alternate, we could have had a program committee and not have made the grantees wait another month in order for the committee to meet again, to review their grant. So that was just my comment. Is that I think that we should
I
stay.
think at the, and that's the intent, but I think at the time we only had like a couple of hours notice. And not realizing that there was that potential, sort of thinking that we need to go outside to get a director to attend. So, but yeah, we'll keep that thought process in mind if there's already a director that could be immediately available. But we didn't realize that.
Any other comments? Alrighty, with that seeing none, we're gonna go ahead and adjourn in the memory of Arthur Shaw. Thank you.
And I'd just like to comment regarding Director Short to the district also did a $500 donation to the Jewish National Fund.
We're gonna go ahead and.
Take this.